Welcome to our evidence-based practice study for CAUTI prevention in long-term care, presented by David Drews, Susan Hoelter, and Christy Hogan. The purpose of the study is to reduce the recent high incident rate of CAUTI in a long-term care facility. This study will be used to determine the cause of the increase and ascertain if implementing a change in the urinary catheter protocol, or UCP, will have a positive effect in reducing the rate. The proposed change in the UCP will involve basic perineal care versus enhanced perineal care and will compare the use of soap and water versus the combined use of soap, water, and chlorhexidine wipes during AM care. This study is needed as urinary tract infections are the most common healthcare associated infections, or HAIs, with an estimated annual rate of 560,000 annually. The goal is to decrease the risk of the most common infections in the United States and prevent excess health costs and prevent patient morbidity. It is estimated that up to 387,550 are preventable CAUTI, and that approximately 5 to 10% of elderly residents require chronic urinary catheter use in long-term care facilities. The Joint Commission National Patient Safety Goal, effective January 1, 2017, requires accredited nursing care centers to implement evidence-based practices to prevent indwelling CAUTIs. This study will impact nursing practice in contributing data whether implementing a change in a UCP will reduce the CAUTI rate. The top safety concern and national priority, it is imperative to have EBP to support the implementation of treatment modalities to decrease or prevent the risk of CAUTI. CAUTIs are a significant problem to nursing and healthcare in general, directly responsible for longer health stays, increased healthcare costs, and reduced or denial of payments to hospitals as preventable healthcare associated infections. It also increases the safety risk of affected patients. Various CAUTI preventative strategies, practices, and patient safety initiatives exist that are proving effective in reducing the infection rate. The facility in the study presently utilizes a urinary catheter protocol and bedside checklist for placement and monitoring of indwelling catheters. This study proposes a change in the existing UCP to determine if the enhanced perineal care, which is the combined use of soap and water and chlorhexidine wipes, during AM care would reduce the CAUTI rate. Measurement indicators would compare the existing CAUTI rate against the rate after implementation of the change in the UCP in a 3-month period. The setting is a long-term care facility with a full capacity of 100 elderly residents. Approximately 20% of the residents have indwelling catheters. The setting will provide an ample sample group to conduct the study. The facility has recently experienced a CAUTI increase in the resident population. The study participants will be the residents of the facility, and inclusion criteria will include 2 groups. The first group is any short stay or long stay resident with an indwelling urinary catheter, and the second group are residents without an indwelling catheter. Exclusion criteria will include residents with intermittent catheters, residents receiving end-of-life care, and residents with existing urinary tract infections. The number of people in the study will be 20, and the sampling method will be convenient sampling as the residents are readily available. The resources will be education of nursing and ancillary staff, i.e. patient care assistants, technicians, physical therapists, and patient transporters, by the nurse educators and mandatory competency training on best practice guidelines. Also, the cost of data analysis software and IT staff to document the CAUTI rates, and the time and space needed to train staff. Also, using nurse-driven protocols, the rubric for professional nurse to make independent decisions based on patient necessity with less consultation with physicians. This will be a quantitative study, and the research design will be non-experimental based on evidence-based practices and protocol. Proposed changes to practice will include the implementation enhanced perineal care to prevent CAUTI, nurse-driven protocols, and involvement of ancillary staff members in addition to nursing staff, with close monitoring and recording of data obtained. The conceptual framework selected for the study was the Institute for Healthcare Improvement Framework for SPREAD. The framework was designed to develop and implement changes in an accelerated pace to realize the benefits sooner.
Framework. The conceptual framework selected for the study was the Institute for Healthcare Improvement Framework for SPREAD. The framework was designed to develop and implement changes at an accelerated pace to realize the benefits sooner. Data collection. Data will be collected relating to perineal and catheter care from patients able to void and those with indwelling catheters. The data will be collected daily each morning during their scheduled AM care. A nurse will be responsible for recording data, including the number of days the resident is catheterized, the type of perineal and catheter care administered, and note if there's any symptoms of a urinary tract infection. Data collection. The nurse will monitor and record data on whether proper insertion, maintenance, and removal techniques are being followed. The nurse will also document dates of insertion and the viability of removing the catheter to prevent a possible CAUTI. All data will be collected over a 3-month period, and collected data will be provided to the facility's Quality Assurance Department for a statistical analysis. The number of catheter days, change in CAUTI rates, and the type of perineal care will be analyzed to determine a proper plan of action. Example would be education, in-service, training, to determine whether a change in the UPC was effective in reducing the CAUTI rate. Synthesis 1 came from an article called Implementing Clinical Guidelines to Prevent Catheter-Associated Urinary Tract Infections and Improve Catheter Care in Nursing Homes. This is a systematic review from the American Journal of Infection Control by Gould, Gaze, Dre, and Cooper. The purpose of the article is to determine if implementing clinical guidelines can reduce or improve the quality of care and infection rate amongst individuals in the long-term care settings with urinary catheters. The findings are the study identified a need to ensure evidence-based practice is implemented to prevent catheter-associated urinary tract infections in the catheterized residents in nursing homes. The relevance is the main expert consensus opinion formulates the clinical guidelines to prevent and control CAUTI. EBP and randomized controlled trials need to be considered when implementing nursing care and provide the best possible care for these individuals. The feasibility, a systematic review and critical appraisal of the literature of 8 studies to assess if the implementation of clinical guidelines aids in prevention and improvement in CAUTI in the nursing home setting. The benefits are to decrease the risk of the most common healthcare-associated infections in nursing homes by advancing nursing research to a higher degree. And the risks are insufficient clinical research is documented in the prevention of CAUTI, therefore the risk of complications related to CAUTI are prevalent. Synthesis number 2 came from an article called Nurse-Driven Protocols and the Prevention of Catheter-Associated Urinary Tract Infections. This also is a systematic review from the American Journal of Infection Control, and the author is D.J. Durant. The purpose of the article is to evaluate the effectiveness of nurse-driven protocols and the reduction of catheter-associated urinary tract infections. The findings, with improved study design and greater standardization, a more reliable body of evidence could be developed, which would have the potential to raise the level of evidence if pooled. The relevance, the lack of clinical evidence to base care practices on in regards to prevention of CAUTI. The feasibility. The Institute of Medicine provided guidelines, and then a meta-analysis of studies were published in the United States from a variety of sources. The benefits, clinical predictors, and prevalence of CAUTI may be positively impacted by nurse-driven protocols. Therefore, grant nurse autonomy when caring for patients. This means that nurses would have the privilege of implementing care for patients without having to utilize or speak with a doctor directly. The risks, quality improvement is necessitated by the patient care setting. The risk of bias is high in this study, and standardized measures need to be utilized when conducting data extraction and analysis to improve the study design.
The third article is a national collaborative approach to reduce catheter-associated urinary tract infection in nursing homes, a qualitative assessment, published in 2017. As stated in the title, this is a qualitative assessment with a goal to reduce healthcare-associated infections, specifically CAUTIs in nursing homes. The researchers conducted interviews with 8 organizational leads and 8 facility leads who were in charge of infection control at their facilities. The study noted that the prevention of CAUTI long-term care facilities has been a national priority since 2013. The study noted that many nursing homes are complying with this directive, but that problems such as knowledge gaps, limited time for training still exist. Consecutive months in 2016, telephone interviews were performed with 8 organizational and 8 facility leads. An interview guide was developed to elicit the individuals' opinions about their program's implementation, their experiences, and practice revisions and recommendations for improvement. The study noted that while the infection control program is valuable, it did still have some barriers such as staff and physician support, amount of time required for implementation, logistical problems, and staffing turnover. The study concluded by highlighting the importance of a collaborative approach by both organizational leads and facility leads for CAUTI prevention. The qualitative findings help to understand the results of reduction of CAUTI in nursing homes through organizational and educational improvements. The fourth article we used was Use of Indwelling Urinary Catheters in Nursing Homes, Implications for Quality Improvement Efforts, published in 2016. A purposeful sampling approach was used to identify 28 diverse facilities defined by bed size, quality ratings, and ownership. The criteria to be included in the study were having a catheter in place and being a nursing home resident for 100 days. The study measured the duration of catheter use and if indications for catheter placement were documented. Indications considered appropriate included urinary retention or outlet obstruction, pressure ulcer, stage 3 or 4, with risk of contamination by urine, hospice care, and need for accurate measurement of input and output. There were 228 residents who met the eligibility criteria for the study. Of those, 193 were noted to have an appropriate documented indication for the IUC as stated previously. One limitation of the study is that the group of nursing homes selected was not a random sample, which might not produce a representative sample. Another is that short-stay residents were not included in the study. Finally, the study relied on documentation from the nursing homes instead of direct assessment by the researchers. The study concluded by stating that although inappropriate catheter use has decreased, there are still high rates of CAUTI diagnosis, sometimes due to asymptomatic bacteriuria. The study also stated that efforts should be made to improve the care of catheters, not just concentrating on decreasing their use. Data analysis. All data will be collected over a 3-month period, and collected data will be provided to the facility's Quality Assurance Department for statistical analysis using IBM SPSS software. The number of catheter days, change in CAUTI rates, and type of the perinatal care will be analyzed to determine a proper plan of action, i.e. education, in-service training, etc., to determine whether a change in the urinary catheter protocol was effective in reducing the CAUTI rate. Challenges. Time required to implement the program, especially during the startup period. Staff resistance to changes. The largest barrier always is, this is the way we've always done it. Another challenge is the need for repeated education due to staff changes. Logistic barriers, such as ensuring the availability of chlorhexidine wipes, software, and computers for data collection and analysis. Measured outcomes. Analysis of data of rate of CAUTI monthly NOTI rate difference before the use of chlorhexidine wipes and after the implementation of the change. Rate of CAUTI measured using diagnostic criteria such as fever, rigors, hypotension, flank pain, leukocytosis, acute mental status change, or a positive urine culture. This is used to determine if a reduction in the CAUTI rate was achieved. Implement and evaluate by the staff development in the nursing home. Specialized training by nursing education and nursing staff on the proper use of chlorhexidine wipes. This will include quarterly reevaluations of technique. New staff will be instructed during orientation. Institution of mandatory competency training for all staff to perform catheter care. Education of ancillary staff on proper perinatal and catheter care. This will include proper urine collection bag emptying and securing. This will be done by nursing education. Integrate and maintain. Discuss with logistics about any potential budget changes or ordering of chlorhexidine wipes. Communicate with nursing educators on the scheduling of trainings. Meet with nurse managers to discuss implementation and staff education. Conduct briefings with facility staff and distribute CAUTI literature. Follow-up emails to remind and reinforce the purpose of the study. Announcements during all shift reports to commence the change in catheter care. Also, maintain annual in-services on catheter care with nursing and ancillary staff. Incorporate new evidence-based practice learned into new policies and procedures. Maintain annual proficiency certification in current catheter care policies. Any extra costs associated with using the evidence-based practice can be subtracted from the savings due to decrease in CAUTI treatment as shown by the decrease in CAUTI rates. Conclusion. How does this benefit the facility and staff? It provides for the best patient care by using evidence-based practice for catheter care. Cost savings through a lower CAUTI rate. A healthy environment for the residents and staff due to less exposure to infections. And also higher healthcare ratings for the facility. And thank you for listening to our presentation. Here's a list of our references. Good day.